one way or another, I've been treating presbyopia for over 20 years, and we started using PressBeyond, and we're the first ones in North America to offer it to our patients in 2008. I started treating presbyopia as part of cataract surgery. Initially was attempting to do what we touched on earlier, was to do some monovision and finding it dissatisfying, and then going on to using what was essentially for cataract surgery artificial lenses that had multiple focal points, otherwise called multifocal lenses, and finding that for some people they worked really very well, but they also had very significant downsides, and a lot of the patients do have issues with night glares and halos to the extent that some people then don't even drive at night or don't ever feel comfortable driving at night. To then looking and finding other solutions for treating presbyopia, and essentially at some point coming across that new treatment that was then called laser blended vision, is now called PressBeyond, while at the same time actually also changing my cataract surgery to employ the same principles that PressBeyond was actually employing, which is using a slight offset between the eyes and increased depth of focus. So I had already started to modify the lenses I use in different patients to use lenses with different optical characteristics in different patients based on how that lens was going to interact with the given person's cornea, and found that PressBeyond was mirroring my approach for the lens surgery, because using that approach, even in the cataract patients, we can get a good number of them to be free of glasses without having to use the multifocal lens. And certainly marrying the PressBeyond approach later with a monofocal lens will get rid of that. So we started to use PressBeyond maybe some 8 years ago or so, as soon as it was first approved for use in Canada, and our first patient is still doing just fine without his glasses 8 years later without any problems. And he was at the more at the extremes of vision correction. He had about almost 4 diopters of astigmatism, which is actually quite a significant amount, and a significant amount of nearsightedness, and it's worked out well. So I've been very happy with the solution to PressBeyond. As I alluded to earlier, I've looked, and we have intermittently offered some of the other things, including one of the inlays, and we always been able to manage to get the patients to the desired endpoint, but any of the other solutions really were a lot more work and a lot more difficulties in the post-operative and a much longer recovery. So the PressBeyond and for the cataract patients, a lens-based approach have really been the best solutions for our patients in my practice, and that's what we're currently providing.